Hello, are you Carly?
Yes, I am.
I'm Jessie. I'm going to be your nurse, and you are?
Amanda, I'm her daughter.
Okay, nice to meet you guys. So you come into me today, you've been having some general fatigue and weakness in your joints, I hear, for a couple months now.
Yeah.
Tell me more about that. Tell me how you're feeling and more things about your pain and stuff like that.
Yeah, I've been really just tired. I just feel off overall, but my joints, like especially in my hands, have just been really sore and painful. I feel it in my knees and stuff too, but especially in my hands. And I've noticed stiffness, especially in the morning. I feel really bad in the morning. And then I just have these bumps on my hands. I'm not really sure what they're from.
Okay. Anything else you can think of?
No.
Okay. So you said that you've just been feeling weak and tired. Are you having fevers with these?
Yeah, about a few times a week I've noticed I've had a little bit of a fever, but it's nothing really of concern because it's not a bad fever, just like a low fever.
Okay, so you don't feel sick, you're just tired and a little fever.
Yeah.
Okay. And then you said that you're weak. Are you having problems with your activities of daily living, such as brushing your hair and brushing your teeth and eating and stuff? Daughter, what do you think? Have you noticed anything?
Yeah, she's been having a lot of pain, like when she brushes her teeth or like when we eat breakfast early in the morning. Her hands just aren't doing what they used to do. She has a lot of pain.
I know you said this stiffness is more in the morning. About how long does that usually last in the morning?
I would say probably like an hour, maybe a little longer.
Okay. I'm going to take a look at these nodules that you said you were having. Yeah, it looks like you have a couple on your proximal joints here. A little redness, and they're pretty warm. Are you having pain when I'm touching them?
Yeah, it is a little sore.
Okay. Go ahead and move your hands, move your joints, and rotate your wrist. Are you having pain with that?
Yeah.
Okay. So the nodules that you have are known as Neverden knots, and they are indicative of some type of arthritis. Okay, so we'll have to look more into that and see what doctor has to say, but you do have some pain and swelling and redness and stiffness in your joints here, and it's affecting your activities of daily living. You said they last longer than a half hour, more towards an hour in the morning. Is there anything else that you can think of that you're having issues with?
I haven't felt hungry either, but I never really thought anything of it.
Yeah. Okay, so I'm gonna go ahead and talk with doctor, and we'll see what she thinks, and we'll both come back in and we'll talk to you about what she thinks it is, and we'll go from there. Okay? Do you have any more questions for me?
No, I'll just wait for the doctor.
Okay.
Hello, I'm Dr. Lucia. Nice to meet you. Your name is Carly?
Yes.
And you are?
Amanda.
Sorry. Nice to meet you. You're her daughter?
Mm-hmm.
Okay. So, I talked to the nurse a little bit. So, tell me how you're feeling. Got some soreness and stiffness?
Yeah, like I told her, I've just been really tired and like all my joints are sore, but especially my hands, I just felt really sore and there's these bumps on my hands.
Do you mind if I take a look? Yeah, she definitely
Has those Neverden nodes, yeah.
I can feel some heat. So how long has this been going on?
A few months.
A few months. Is anything helped or make it worse? Any activities or?
Well, it's definitely worse in the morning, but it does help to take ibuprofen, and I've tried putting, like heat and ice on it. Sometimes one of those helps, but
Not all the time, just once in a while.
Sometimes. I mean, it helps a little bit, but even not enough.
Okay. All right. Do you mind if I take a look at your elbows? I'm just gonna check some of your joints. So.
She said it does last about, her morning stiffness lasts about an hour in the morning. She is having some hard times. Daughter had said she was having some hard times eating and doing her morning routine with her fine motor of her hand.
Has that been going on for a couple months as well?
Yeah.
Okay. So, do you have any other like joint areas, or is it just mostly your hands, or?
Yeah, like it's it's worse in my hands, but it's also like in my knees and my ankles and elbows and everything.
All right. So I'm going to run a couple tests for you.
She said she has had an x-ray done. It was a couple of years ago with a previous doctor, but they said that it hadn't shown anything.
Okay. We'll contact that doctor, just so we can get a look at that, but I'm gonna run all of my own tests. It looks to me that you might have an arthritis called rheumatoid arthritis, and you said that your mother had that before, right?
Yeah.
Okay, so you're kind of familiar with the disease. Okay, so how it's an autoimmune disease, and like your normal joints that are healthy, but your body feels that they're foreign, so they're gonna attack it just like a bacterial or any other infection that your body would have. It's going and causing all that inflammation, which is causing the pain in the mornings, and it mostly causes issues in your small joints, so your hands are gonna be affected for sure. So the first thing we're gonna do is do a full workup of like all your blood work, just to get a new reference of everything. We're gonna look to see if you have any anemia, which is low red blood cells, anything like that. And then we're going to schedule an MRI and ultrasound, if that's okay with you, just to get and an X-ray, just to get a whole new look at everything. Because if you do have RA, which it is looking like you do, it will help judge the severity of it. And then we can go from there with treatment options. Do you remember what medication your mother was on before? There's a little patient handout.
Yeah,
for treatment.
my mom took Humira, but I don't know, like, if am I gonna have to take medication?
Yeah, if you do have RA, we're gonna probably put you on some type of regimen of medication, and we can figure out, depending on the test results, what would work best for you and how often you would need to take that.
Okay.
So you've been already taking ibuprofen?
Yeah, I've been taking ibuprofen, but I was reading online that, because my mom had RA, so I read about it online, and sometimes they have to take steroids or methotrexate, or I saw a commercial for Humira and Xeljan, so I was just wondering, am I gonna have to take all of those or just some of them? Or?
No, we're gonna look at what you have, and typically we're only gonna put you on some of those. We'll see which work best. We may have you on a certain medication for a period of time. If you don't feel like it's working or your symptoms are getting better, then we're gonna switch it up, because every medication works a little differently on all of that stuff.
We're going to work very closely with you. We'll have you do follow-up appointments after you get your blood work and your MRI. We'll take a look at what we see, and then we'll go from there. If you're not feeling better on a certain medication, then obviously we need to change that medication for you so we can get you feeling to the best of your ability, so you can, have breakfast with daughter and you can brush your hair in the morning and stuff like that, because those are important things for you to do.
We can't. Medication typically doesn't reverse what's already happened, but since it's a chronic disease and it will continue to affect the joints, as soon as we get you on the medication, you shouldn't have any more further damage than you already have, and it should help with the stiffness and like the pain you're having, so you can continue your daily living.
Okay, when I was reading online too, it said that in like really severe cases, some people have to have surgery. Am I gonna need to have surgery?
Well, we'll look at your test results. As I look at you, I don't think you're gonna need surgery as of right now, just because of where you're at already with what I can see. So at this point, I don't think you need surgery, but surgery is an option if it gets very severe for patients.
Okay. Do you think like physical therapy or occupational therapy would help with like, especially with like getting ready in the morning and stuff like that?
Yep, I'm actually gonna have a physical therapist come in a couple minutes with a nurse and show you some exercises you can do and help. We just want to get you moving. The more you move, the better you'll feel. So the exercises every day will help you gain control.
It'll probably
back.
take about a week for us to, our case manager will also talk with you, and we'll get you all set up with this lab work and these MRIs and with physical therapy and occupational therapy, but it'll take about a week, so we want to get you some exercises now so we can get you started and moving these joints, because we want to slow the progression of your disease as much as we possibly can.
Okay, that makes sense.
Yep, the faster we start treating it, the better you'll feel. So.
Okay. Alright, thank you.
Alright, well, it was nice meeting you.
Yeah, nice to meet you.
And then we'll be back in. I'm going to go meet with the physical therapist, and we'll be back in shortly, okay?
Yes,
Thank you.
go ahead.
Hi, I'm Stephanie, the physical therapist. Doctor and the nurse wanted me to come in and just give you a couple exercises that you can do at home over the course of the next week until we can get you to follow up with physical therapy and occupational therapy, okay?
Okay.
So I know they said that it's primarily affecting your hands. Is that correct?
Yes.
Okay, so I want you to do, this is a supination position, and then you twist them over, and that's pronation. So you can continue to do those, and that'll help with your wrist joints there. Okay, and then you can do a lot of, individual fingers. Just make sure you're moving those joints so you're not losing any more function of them.
Okay.
Okay, and then go ahead and stand up for me. So we're going to move our arms away from our body. That's going to be like this. There you go. And then down. And you're just going to be moving these joints.
Okay.
And then you can do that with your elbows like this, so you're moving them.
Okay.
Alright. And go ahead and you can hang on to me if you need, and then just move up there. Yeah. Good job. And then just bend those knees up. And there's one to move your ankle joints. You're going to move your sole of your foot in, and then move the sole of your foot out. Alright, and you're going to be making sure that you're getting all those joints, okay?
Okay.
And then you can do these anything you feel is comfortable for you to move these joints and get yourself moving, okay?
Okay.
Do you have any questions for me? Those are just a couple things I want you doing over the course of the next week, and then they'll get more in detail with you in physical therapy.
Okay, so I should probably start physical therapy in about a week then?
Yeah, next the case manager will be coming in. She'll discuss a lot of things with you to make sure you're getting the proper follow-up and discharge care, and she'll help you, with all that sort of stuff, okay?
Okay. Alright, thank you.
All right.
Hello, how are you doing today?
I'm alright.
My name's Tasha, I'm the case manager.
Hello, I'm the doctor. Anita.
Hello, nice to meet you.
Nice to meet you.
So, how are you feeling?
As good as I can be right now.
Yeah. Are you having any depression or anxiety?
I've just been really tired all the time. I just haven't really been doing much, so.
Right, yeah. A lot of times with rheumatoid arthritis, people can start feeling a little down because they can't move as much, they're in a lot of pain. Are you having any of those feelings?
Yeah.
Kind of frustration and
Yeah, it
not
is.
really socializing as much?
It is frustrating not being able to move like I used to, So a little bit, yeah.
Okay. Well, I've got some information here for your post-discharge and everything, and we're going to kind of refer you to some different things, maybe like a counselor or something, a therapist that you can go and speak to about all of these feelings that you're having. They have lots of support groups and self-help classes for people with RA, so you can go and you can mingle with people who have the same thing that you have, and kind of figure out the best way to go about dealing with, finding out that you have this condition. There's also a lot of alternative therapies that you could do, hypnosis, acupuncture, imagery, music therapy, stress management, all these things that you can try out and see if any of that works for you. Okay. So the Arthritis Foundation has a lot of good information. It's arthritisfoundation.org. It's all in here as well. How's your diet?
I haven't really been eating that much, but when I do, it's just usually something like not real healthy, honestly. But
Right. Well, it's said that eating a balanced diet is very, very good for rheumatoid. Rich vegetables, fruits, whole grains, lean protein, they can increase your energy and boost your mood, make you feel a little bit better each day. Junk foods, well, it can actually aggravate the inflammation and cause you to gain weight, which will put more pressure on all of your joints.
okay.
So, going on to arthritisfoundation.org, we can get you a dietitian. On that website, there's a lot of information about healthy food choices that you can choose whatever you want. So, do you have any religious or spiritual preferences?
I'm a Christian, but I haven't really been going to church or anything. It's just really hard to get out.
Okay. Did you go to church before? Do you have do you know any religious leaders that, might be able to assist you in?
Yeah, I used to go to church, so I mean, maybe I could get in contact with someone at my church.
Yeah, that would be a really good idea. Okay. Let's see. How advanced is your RA? Would you say? Do you have issues with getting around your house?
I wouldn't say that, not yet. I mean, I know it's progressive, so it could possibly get to that point someday. My mom did, so.
Okay. Yeah, there's a lot of good information out there about different tools that you can use. They have utensils that'll help. They've got bigger ends that'll help you grip things that a little bit better. Raised toilet seats. There's they can put handrails, or God forbid it ends up progressing to the point where you need a wheelchair. There's wheelchair accesses that would need to be built, and all that information would be in here about social security, disability, and things that can help pay for those additions to your home. Okay. We're also going to get you set up with a rheumatologist. We have a lot of different rheumatologists in the area that you can call, PT and OT, that you can get a hold of to schedule some appointments when you leave. Also, my number is on here if you have any questions.
Okay.
So, do you have any questions?
Not right now, but I'll get a hold of you if I have any.
Okay. All right. Well, it was very nice to meet you.
Thank you.
Thank you.